Good morning. My name is Senator Adam Gomez, and I represent the Hamden District, and I am joined by my co-moderator, Representative Carlos Gonzalez. And before we both introduce ourselves, I want to thank our friends, families, and also co-workers that have come together for us to partner with Caring Health Center on this virtual town hall. Today is Wednesday, March 10th, 2021. And we are really delighted and excited about getting this information from our healthcare professionals out to the community who best need this. So without further ado, I would like to introduce my co-moderator and let him introduce himself, the Honorable Representative Carlos Gonzalez.
Thank you, Adam. This is my second chance at it, but thank you very much to all my friends and I would say family at the Caring Health Center. Thank you for the outstanding work that you do serving the most needy in the city of Springfield. It's an honor to be here with you to again host with my senator this town hall to bring information, communication to the communities that we all serve. And during this pandemic, I just want to just say that we have gone through some difficult times, but also some hope and admiration for the essential work that you have always done, but more importantly, during this period of time. Thank you again, Tanya, for your leadership on the Caring Health Center and the whole staff. A pleasure to be here, and we look forward to engaging with the community as they ask questions, and we bring about some answers to some of the myths and misinformation that's out there regarding COVID vaccination, and how we can best serve to get this economy and get this country back in the right track. Thank you.
Thank you, Rep. Gonzalez. Before we get into our program, we're going to have a few words from the fearless leader from Caring Health Center, President and CEO, Tanya Barber. Before I let our CEO speak to the public, and I'm going to give a brief introduction on who Tanya is. So please bear with me because it's very lengthy. We know that she has been a community member and obviously a leader in this healthcare industry for a very long time. And I just want to say, Tanya, it is a blessing to be able to partner with you and with Caring Health Center. As the President and Chief Executive Officer of Caring Health Center, Tanya Barber, MBA, leads the only federally funded community health center in the city of Springfield. Joining CHC in 1996, Barber has worked in various roles. She began in switchboard operations and worked her way up the ladder. She would eventually become the front office operations manager, chief operations officer, then executive vice president, followed by her current role as president and chief executive officer in 2013. Recognized as a servant leader who has compassion for the people, Barber serves as a full-time pastor and founder of Living Water Global Ministries in Springfield, Massachusetts. She sits on several boards, including the board of directors for the Massachusetts League of Community Health Centers, Regional Employment Board, Health New England, Bay Path University, and Be Healthy Partnership Plan Joint Operating Committee. Barber also serves as the corporator for Florence Savings Bank. Barber received her bachelor's degree in organizational management from the University of Massachusetts in 2007 and Master's of Business Administration's degree in entrepreneurial practices and innovative thinking from Bay Path University in 2019. It's my honor to present to you guys CEO and President of Caring Health Center, Tanya Barber. Welcome, Tanya Barber. Thank you so much for all the work that you do.
Good morning. Thank you very much. A special thank you to Senator Adam Gomez and to State Representative Carlos Gonzalez We are really grateful for this opportunity and this collaboration, working with each of you and the amazing work that you both do as leaders within our community on this great initiative to hopefully get folks vaccinated, to share information, educate our community on the vaccine and to relieve them of some of their questions and concerns. So I'm going to share a little bit. Also, let me just say thank you to those of you who actually are joining us on this Zoom, but I also wanted to share with you a little bit about Caring Health Center, who we are, and some of the services that we provide. Caring Health Center is a community health center. We are a medical provider. We provide primary care services, both adult and pediatric primary care services, along with dental, behavioral health, pharmacy, wellness, and research, women's, infants, and children's services. We've been around, we've been in the community for 26 years. I've been at Caring Health Center 25 of the 26 years, and I'm really proud of the work that we do here in the city of Springfield. Caring Health Center is also the largest refugee and immigrant provider in the state of Massachusetts, serving in over 34 different languages to over 20,000 patients. So we're really excited about that. We have 4 locations within the community, within the city of Springfield, 4 locations within the city of Springfield. We also, serve individuals regardless of whether or not they have the ability to pay. So if they're dealing with socioeconomic barriers, that's who we are. That's how we actually were created by the community for the community, and that's who we are and the services that we provide. Our mission, of course, is to provide health care to the ill and to comfort those that are sick and promote the highest level of health care to everyone. And I'm here with my team. I'm here with my colleagues, Dr. Jonathan Mosley, Dr. Christina Hubner-Torres, and Shamika. And I'm really excited to have them so that they can share questions, share answers, and then answer questions for any concerns that the community may have regarding the vaccine. So once again, it's my privilege and honor to be here with each of you, and just a special thank you again to Senator Adam Gomez and to State Representative Carlos Gonzalez and to my team. Thank you.
Thank you so much for your words, President Tanya Barber. And right now we're going to share a clip that was put together by Caring Health Center, and just give us a moment to share this video on our screen, and we'll be right back with you guys right after the video.
Hola, mi nombre es Iris López y trabajo aquí en la oficina de Caring Health Center. Obtuve la vacuna para poder pasar tiempo con mi familia de manera segura, celebrar fiestas, ir a la iglesia y abrazar a mis nietos. La vacuna COVID-19 fue como todas las demás vacunas que he tomado y no me enfermé luego. Después de que toda la familia se vacune, todos podemos volver a visitarnos. La vacuna funciona mejor cuando la reciben muchas personas de la comunidad. Vacúnese y podrá ayudar a que sea más seguro para su familia y la comunidad también. Sé que muchos miembros de la comunidad hispana están preocupados por la vacuna. Como miembro de esta comunidad estoy aquí para decirte que la vacuna del COVID-19 es segura y que es importante que todos los grupos se vacunen. Según los Centros para el Control de Enfermedades, de los 4 millones de personas vacunados, actualmente menos de 10 han tenido efectos secundarios graves. Las personas vacunadas están protegidas de enfermedades graves y hospitalizaciones. Entendemos y respetamos su inquietud y estamos aquí para responder sus preguntas. Venga a vacunarse aquí en Caring Health Center o en algún otro lugar local de vacunación. Gracias, manténgase saludable, que pase bien.
Здравствуйте, меня зовут Диана. Я работаю в клинике Caring Health Center. Мне сделали прививку, и поэтому я могу спокойно проводить время с семьей, отмечать праздники, ходить в церковь, обнимать родных и близких. Вакцина от коронавируса была такой же, как и все другие вакцины, которые я принимала, и после этого я не заболела. После того, как вся моя семья будет вакцинирована, мы снова сможем навещать друг друга. Вакцина лучше всего эффективна, когда ее получают многие люди в сообществе. Сделайте вакцинацию, и вы также поможете осуществить безопасность своей семье и сообщества. Я знаю, что у многих членов русского сообщества есть опасения по поводу вакцинации. Я, как член этого сообщества, я здесь для того, чтобы сказать вам, что вакцина от коронавируса безопасна. И очень важно, чтобы все возрастные группы прошли вакцинацию. По данным Центра по контролю по заболеваниям, из 4 миллионов человек, вакцинированных в настоящее время, меньше 10 имели серьезные побочные эффекты. Привитые люди защищены от серьезных заболеваний и госпитализации. Мы понимаем и уважаем ваше беспокойство и готовы ответить на все ваши вопросы. Приходите к нам в клинику, в Caring Health Center, для того, чтобы сделать прививку. Или сделайте прививку в любом другом месте, где делают вакцинацию. Спасибо, будьте здоровы.
Xin chào, tôi tên là Lý Nguyễn, làm việc ở Caring Health Center. Tôi đã tiêm phòng để có thể an toàn dành thời gian cho gia đình tôi, ăn mừng các ngày lễ, đi đến những nơi thờ phượng và ôm các cháu của mình. Thuốc chủng ngừa COVID-19 cũng giống như tất cả các loại vaccine khác mà tôi đã chích, và tôi không bị ốm sau đó. Sau khi cả gia đình tôi được tiêm phòng, tất cả chúng tôi lại có thể đến thăm nhau. Thuốc này chủng ngừa hoạt động tốt nhất khi có nhiều người trong cộng đồng chủng ngừa. Hãy chủng ngừa và bạn cũng có thể giúp an toàn hơn cho gia đình của bạn và cộng đồng. Tôi biết rằng nhiều người trong cộng đồng Việt Nam có mối quan tâm về vaccine. Là một thành viên của cộng đồng này, tôi có thể nói với bạn rằng vaccine COVID-19 là an toàn. Và điều quan trọng là tất cả các nhóm phải được chủng ngừa. Theo Trung tâm Kiểm soát Dịch bệnh, trong số 4 triệu người được tiêm chủng, hiện nay chưa đến 10 người bị các phản ứng phụ nghiêm trọng. Những người đã chủng ngừa được bảo vệ khỏi bệnh nặng và phải nhập viện. Chúng tôi hiểu và tôn trọng những băn khoăn của bạn và luôn sẵn sàng giải đáp những thắc mắc của bạn. Hãy đến chủng ngừa tại Caring Health Center hoặc một trong những địa điểm tiêm chủng khác tại địa phương. Xin cảm ơn và xin chào.
नमस्ते, मेरो नाम भानु तिवारी। म क्यारिङ हेल्थ सेन्टरमा नेपाली इन्टरप्रेटरको काम गरेको लगभग 2 वर्ष भयो। यहाँहरू सम्पूर्णलाई म स्वागत गर्न चाहन्छु। मलाई खोप दियो, त्यसैले म सुरक्षित रूपमा आफ्नो परिवारसँग बिदाको दिनहरू मनाउन, तीर्थयात्रा गर्न र आफ्ना आफन्तसँग अँगाल्न सक्छु। मैले लिएको कोभिड-19 खोप अन्य खोपहरू जस्तै थियो र म त्यसपछि बिरामी पनि भइन। मेरा सम्पूर्ण परिवारले खोप लगाएपछि हामी सबै एक अर्कासँग फेरि भेट्न सक्दछौँ। जब समुदायमा धेरै व्यक्तिले यो खोप लिन्छन्, तब त्यसले राम्रो काम गर्छ। खोप लिनुहोस् र तपाईले आफ्नो परिवार र समुदायको लागि पनि सुरक्षित बनाउन मद्दत गर्न सक्नुहुन्छ। मलाई थाहा छ कि नेपाली समुदायका धेरै सदस्यहरूमा खोपको बारेमा चिन्ता छ। यस समुदायको सदस्यको रूपमा म तपाईलाई भन्न चाहन्छु कि कोभिड-19 खोप सुरक्षित छ र सबै समूहहरूले खोप लगाउन महत्त्वपूर्ण छ। रोग नियन्त्रण केन्द्रका अनुसार हाल 4 लाखभन्दा बढी खोप लिइसकेका मानिसहरू मध्ये 10 जनालाई मात्र गम्भीर असर परेको छ। खोप लगाएका व्यक्तिहरू गम्भीर बिरामी हुन र अस्पताल भर्नाबाट सुरक्षित छन्। हामी तपाईको चिन्ता बुझ्दछौँ र सम्मान गर्दछौँ र तपाईको प्रश्नहरूको उत्तर दिन यहाँ छौँ। क्यारिङ हेल्थ सेन्टरमा वा अन्य स्थानीय खोप स्थानहरूमा खोप लगाउनुहोस्। तपाईहरू सबैलाई धेरै धेरै धन्यवाद। म तपाईहरूलाई स्वास्थ्य लाभको कामना गर्दछु। हस्त धन्यवाद।
مرحبا، اسمي رفيدة القيسي وأنا أعمل في الكيرين هيلث سنتر كمترجمة اللغة العربية. لقد تلقيت التطعيم حتى أتمكن من قضاء الوقت بأمان مع عائلتي. كان لقاح كوفيد-19 مثل جميع اللقاحات الأخرى التي أخذتها، ولم أكن مريضة بعد ذلك. بعد تلقيح عائلتي بأكملها يمكننا جميعا زيارة بعض البعض مرة أخرى. يعمل اللقاح بشكل أفضل عندما يحصل عليه الكثير من أفراد المجتمع. احصل على تطعيم وباستطاعتك المساعدة في جعل عائلتك والمجتمع أيضا أكثر آمنا. أعلم أن العديد من أفراد المجتمع العربي لديهم مخاوف بشأن اللقاح. بصفتي عضو في هذا المجتمع أنا هنا لأخبركم أن لقاح كوفيد-19 آمن ومن المهم أن يتم تطعيم جميع الفئات. وفقا لمركز السيطرة على الأمراض من بين 4 مليون شخص تم تطعيمهم حاليا أقل من 10 لديهم آثار جانبية خطيرة. الأشخاص الذين يتم تطعيمهم محميون من الأمراض الخطيرة والبقاء في المشفى. نحن نتفهم ونحترم اهتماماتكم ونحن هنا للإجابة على أسئلتكم. تعالوا لتلقي التطعيم هنا في المركز الرعاية الصحي كيرين هيلث سنتر أو أحد مواقع التطعيم المحلية الأخرى. شكرا لكم وابقوا في أمان.
Thank you so much from those messages from Caring Health Center. It just shows the diversity that Caring Health Center is bringing to our community. We know that Springfield is a melting pot of different ethnicities, and we have to make sure that this message is being put out to our community in the different languages. We know that there's a lot more languages out there that we're trying to reach in community members, but I just want to commend the hard work that it took to put that message together. And we're going to be using that message periodically to share, to put out to the community that there is access to diversity and to all communities at Caring Health Center. So I want to thank you for that message. And now from our healthcare professionals, we're going to be sharing a slideshow, an overview. So at the moment, I would welcome the presenter to please share their screen, and we can commence on our next portion of this event, which is a slideshow from Caring Health Center.
Does that look okay, Senator?
Absolutely, it looks fantastic.
Wonderful. We'll get started then.
Hi, my name is Shamika Jones, and I am the Infection Control Employee Health Nurse Manager here at Caring Health Center. At Caring Health Center, we have different types of testing that we can do for COVID-19. We have what is called our antigen test, and we also have our PCR test, which is a molecular test. Some people may ask, what is the difference? Are they both the same? What are the results? So I'm just going to give you a little brief overview. An antigen test is just a test that detects protein fragments, just little pieces of the virus, and this is usually done within like 15 minutes. We can have those results for you back in 15 minutes. A PCR test, which is a little bit more precise, it is actually the best to detect COVID-19. It can also detect if you don't have any symptoms. So this is usually just a little bit more precise because it takes that RNA, that genetic material from the COVID virus, and then it looks for those little fragments, and then it detects those within the infection within folks. I'm sorry, I'm a little tongue twisted here today. So this test can be done. Usually it's sent into the hospital to a lab, and it takes about 24 to 48 hours. But now we also have our new platform, which we can also do these PCR-like tests in our offices here, and it takes still about 15 minutes for you to get your results. If you're not a patient currently at Caring Health Center and you do need to get tested, you can also find any testing site on the MS DPH website. And also we are teaming up with and having a new project called the Radix Project, which will be doing community testing and making that available to everyone out in the community, so that everyone who needs to get tested, wants to get tested, should get tested and have those resources available. Just want to also point out that we are now in the current status of doing our vaccines, which is very, very exciting for everyone, because this is how we're going to help our community and help everyone to be safe. We do now offer right now vaccine clinics to our staff and patients Wednesdays and Fridays. And then we also have a Saturday clinic, which is our very larger clinic. But also we know that there's an outpouring and a need for folks to get vaccines. And I know there's a lot of sites out there. So we're just happy to announce that we will also be starting our own vac site, which will be open to the community, as well as the ones that are already out there. You can sign up for a vaccine at CHC if you are a patient. However, at the mass vac sites, you can dial 211 on your phone and get that information. There's also a VaxFinder link on the mass.gov. And soon coming, we will be releasing, like I said, our state vaccine clinic site. So we'll have all that information for you guys as well. Thank you.
Great job, Shamika. She does a wonderful job running our COVID clinic. I'm the Chief Medical Officer here, so I work pretty closely with Shamika and the rest of the team. We wanted to show this slide because it really demonstrates something that we care very deeply about here, which is the inequities that have been exposed by the COVID pandemic. The US healthcare system has always favored those who are wealthier and white, and unfortunately the COVID pandemic has just been really more of the same. In a fully just, equitable society, all these different color rows would be equal. It would affect people who are Native American, Hispanic, Black, white, all the same. But as you can see, there are more people of color who are getting COVID. And then on the right, sadly, there are more people of color who are dying of COVID. I can tell you that that's really the reason why we work here at Caring Health Center, is to try and correct these disparities. And so one of the big ways to do that is through the vaccine. So we're going to be talking about that.
Jonathan?
Yes.
It looks like they can't see the screen. Let me see. I can see your screen. Keep going.
That's great.
Hi, everybody.
That's great. That's great. Thank you.
Okay.
Great. Thanks, Jonathan and Shamika, for those initial slides. And my name is Christina Hubner-Torres. I'm the Vice President of Research and Population Health at Caring Health Center and social epidemiologist. And much of this work, as Dr. Mosley just mentioned, is really based in our knowledge and having access to accurate data in order to understand exactly how things are transpiring, not just at the national level, but more locally at the regional level. And a lot of that occurs through really tremendous partnership with many of our community-based organizations, health centers, hospitals, public health departments, and Mass League of Community Health Centers, and so on. Public Health Institute of Western Mass established a COVID-19 dashboard, which gives updates on a 2-week rolling basis of circumstances within each of our regional areas within Western Mass. So this is one example. This slide here is one example showing the current status of confirmed cases, tests, average daily cases per 100,000, and percent positive tests, the number of positive tests out of total tests conducted in the Hampden County. So these slides have hyperlinked segments, these blue areas, where you can go and find these tremendous resources and use them as well. And at Caring Health Center, we pay close attention to not just the national data, but the local and regional data so that we can make decisions about how to tailor our care for our patient population. Even among our patients at Caring Health Center, it's important to know how things have been disproportionately burdened among our BIPOC, Black, Indigenous, and people of color communities. In the top, you can see our COVID-19 diagnoses. 51% have been Hispanic or Latino, and among them broken out by the different racial categories. compared to 49% non-Hispanic. And below that are the folks who have tested positive for COVID-19 at Caring. Again, 62% Hispanic, Latino, broken out by racial category compared to 37.8% non-Hispanic. And I would bring your attention to the fact that even among the percentages of non-Hispanic white in an environment like Caring Health Center, that category also represents many folks who are Russian speakers and Arabic speakers, Nepali speakers, and it can represent a wide range of language and cultural groups. And part of what we know has been going on in terms of the disparities is, as Dr. Mosley mentioned, structural racism and how that has actually been embedded into every institution, including issues of food distribution, housing, employment, childcare in the US. We've seen prior to COVID, very high rates of food insecurity and housing insecurity already in place, which predisposed individuals to increased risk of exposure to the coronavirus, COVID-19 virus, difficulty in isolation, residences of multi-generational households, residences with essential healthcare workers and other essential workers were likely going to have increased exposures. Massachusetts Department of Public Health conducted a community impact survey. Those preliminary results are now available. We see from those results that there was 28% housing and food insecurity, and even up to 62% food insecurity in certain groups. And about 33% of employment insecurity was related to childcare related needs. This is especially true among women compared to men and among Latinx communities compared to white. And so we've taken substantial efforts to mitigate these disparities based on social determinants of health. As I mentioned, partnership is at the heart of this. As part of our efforts to collaborate through COVID mitigation efforts, we have community health workers who are doing no contact delivery of resources, COVID-related resources, things like masks, sanitizer, food, room dividers, air mattresses for folks who might have difficulty isolating among those who test positive or at high risk for COVID. And we do a tremendous amount of work around cultural and linguistic tailoring of communication, information, and care.
Yeah, you can tell Dr. Huebner-Torres is an amazing leader. She's been so crucial at tracking the numbers and helping us to really work to serve our community. The vaccine is our best hope for ending this pandemic. And I think this graph shows well how it works. This was the trial upon which the Moderna vaccine was approved. So at the point that the vaccine was given versus the placebo, you can see day 0, the lines immediately start to diverge. So the blue line were the folks who did not get the vaccine, who got the placebo in this trial, and their COVID infection rates climbed, just like the normal population. But in those who got the vaccine, the pink line, they stayed almost flat, 95% effective. That's about as good as any vaccine or any medicine ever gets. So really good effectiveness data here. And as you'll hear us say a few times, the side effects were really mild. No one has died from the vaccine. So just a month ago, 4,000 people in the US were dying per day of the vaccine. 50 million people in the US have gotten at least one dose of one of these vaccines. No one has died of it. So that's a pretty big difference. How do these vaccines work? Well, the Moderna vaccine is an mRNA vaccine, which is really cutting edge in terms of technology. Prior vaccines would actually inject part of a virus into your body, and then you would develop an immunity to it and be protected against that virus in the future. What mRNA is, it's actually the instructions to your body for producing immunity. So you inject the mRNA, and the vaccine just contains the mRNA particle as well as fat, sugar, and salt. That's all it is. Your body produces the proteins and then the antibodies to the proteins. It's a technology that's been really years in the making, and COVID gave us the ability to apply this technology in a really important setting. I think it's important to know that even though the vaccine was developed quickly, safety was not compromised. All the steps were followed. And you can see here in this slide that normally, if you look at phase 1, phase 2, phase 3, those phases are separated by months, sometimes even years, as funding is gathered and as the data is collected and reviewed. In this case, because there was so much attention, so much urgency and funding, these phases overlapped in some cases. So as phase 1 was ending immediately, we're moving into phase 2 and then immediately into phase 3. And even before we had all the data on effectiveness and safety, these vaccines were being produced. Now it's important to say that if the vaccines had not been safe or had not been effective, they wouldn't have been released, but they were, and immediately Moderna and Pfizer had the vaccines ready to go, ready to be distributed as soon as the data was in place and as soon as the FDA reviewed the data and made sure that it was safe. There are some side effects, and we have to acknowledge that, but very similar to other vaccines. So you can expect when you get the vaccine, your shoulder will hurt. 68% after the first shot and then 75% after the second shot of people, their shoulder hurt at the site of the injection for a day or 2 or 3. About half of people were tired, were fatigued, about half of people got a headache. But these side effects, are nothing like COVID. I heard some person say after they got their shot and their shoulder was hurt, and they said it hurts so good. It's a sign that the vaccine's working. Your body is producing immunity against the mRNA to protect you from the next time you're exposed to COVID. So hopefully you won't get a side effect when you get yours, but if you do, just know it's a sign that it's working. And I think it's important that we touch on this topic of herd immunity because this is really what we're trying to achieve with the vaccine. Herd immunity, it's like a fence around you. And Christina likes to use the term donut. So everyone that's around you, your family, your coworkers, your neighbors, your kids' teachers, the people who work at your grocery store, the people who deliver things to your homes, those are all part of your donut. And when all those people are vaccinated and safe, then you're protected inside your donut. But when someone is not vaccinated, it takes a bite out of your donut and leaves you exposed to the vaccine. Remember that you're part of someone else's donut. So when you get vaccinated, you protect your family and your friends and your coworkers, just as they get vaccinated to protect you. And so when you get vaccinated, it's important that you don't just stop there. Talk to those people around you so that you can protect them and build that herd, that fence, that donut around yourself to keep safe.
So I want to acknowledge, there has been a lot of information, an inundation of information, and it's very difficult in the current landscape to know what information do I listen to? What information is accurate? How do I make sure the information I'm having access to is telling me the real story? Where do I put my trust? At Caring Health Center, we really take your concerns so seriously. You have the right to have concerns. You have the right to ask questions. And we want to be a valued member of your community who can help you think through those questions and get to a point where you make the right decision for yourself and for your family. One primary concern we've heard a lot about is the history of mistrust of medicine and research due to historical injustices, especially among people of color. And that is absolutely true. There is a real history in the United States of historical injustice and atrocities when it comes to elements of medicine and research. It's not without going forward to not acknowledge that truth of our history. So we do have to know that history. We do have to acknowledge that it's real. At CHC, our approach is really to try and make every aspect of the medical care patient-centered, culturally and linguistically tailored. We want to make sure that we provide clear information so that you can make an informed decision. Ultimately, the decision to get the vaccination is 100% yours. It's up to you and it's up to your family to make the right decision for yourselves. We do hope that all members of the community will get vaccinated. And that will ultimately help each of us regain a place where we can be spending, first and foremost, time with our families, but also re-engaging in our communities in ways that we really love. Another concern that comes up frequently from our patient population is possible side effects, and Dr. Mosley just walked through those common side effects that one might expect. It's not that they don't exist, they may, but to Dr. Mosley's point, those side effects are often evidence that you're having an immune response, and they tend to be mild. And so the vaccination process includes an observation period so that people can be sure that they've had a safe vaccination in the moment. And certainly any of those mild side effects that you may experience are expected to resolve within a couple of days. There's also been substantial concern about the concept of tracking and surveillance through the vaccine. This is a really important concern that people are raising, one that we want to acknowledge is on people's minds. We want to clarify and make it very clear, there is no microchip or any kind of a surveillance chip in the vaccine. As Dr. Mosley mentioned, the vaccine consists of the ingredients of the messenger RNA and elements that make it soluble and able to be used by your body, salts, sugar, and lipids, fats. But there is no microchip in the vaccine and no surveillance or tracking element. Others have mentioned a really important step that they're taking, waiting to see how it goes in others before they decide to get it, or acknowledging that they'd like to check with their family, their provider, or their faith leader. We think that's a great decision. You should make a decision based on the information that you can gather from the people who you trust. And the decision, as I've said, and we've all said, is yours. Having those conversations is going to help you to understand the accurate information. And what we would like to convey from Caring Health Center is that the scientific evidence shows that the vaccine is safe. The scientific evidence shows there have been no deaths from the vaccine. And so again, as your healthcare providers, we encourage you and your family and the community to get the vaccine. I'd like to acknowledge Dr. Mosley, that hyperlink at the bottom there is to our Massachusetts League of Community Health Centers, who has produced a wonderful facts, frequently asked questions resource in both English and Spanish, and answers a lot of the important questions that you all are asking.
Great.
As I've been mentioning, building trust is another critical element, and particularly among our Black and Brown communities, this has been extremely important because of the way that we've seen social determinant and structural barriers highlighted through COVID. This publication, Power and Immunity, Information for Protecting Our Bodies and Our Communities, contains some tremendous input and insights. And I just want to quote Dr. Corbett, who's been deeply involved in the development of the mRNA vaccine and on the front lines of this important scientific work. Dr. Corbett says, "You've earned the right to ask questions that you have around these vaccines and this vaccine development process. Trust, especially when it has been stripped from people, has to be rebuilt in a brick-by-brick fashion. I'm doing my part in laying those bricks." And Dr. Corbett is joined by other leading scientists and advocates in the work from different people of color backgrounds, and the link there will also bring you to that resource. And I encourage folks to read through that as a great opportunity to see all aspects, many facets of how building trust and getting information, accurate information about the vaccine out to our communities is included.
I'll just add, if any of you have a chance to Google Dr. Corbett, she's an amazing speaker, and she was really she was really important from the very beginning in terms of getting people of color involved in these vaccine trials and making them reliable for all segments of our society.
So also we have some really critical guidance that's been provided from the Centers for Disease Control. Once you've been fully vaccinated, which specifically refers to once you have 2 weeks after your second dose in a 2-dose series like Pfizer and Moderna vaccines, there are several things that won't change immediately. We should all continue to protect ourselves in situations where all the recommendations to wear a mask, stay 6 feet apart, and avoid crowds or poorly ventilated spaces remain. things like being in public areas or gathering with unvaccinated individuals. And these strategies continue to help us protect one another because, to Dr. Mosley's point, achieving herd immunity is something that's going to take time. And it would be very difficult to know when we're out in the public who has been vaccinated and who hasn't been vaccinated. So for the safety of yourself, your family, and the larger community, the recommendation is that we continue to follow these excellent practices that have been shown scientifically to reduce potential exposure to COVID-19. However, once we've been fully vaccinated, again, 2 weeks after a 2-dose series of vaccines, there are some really important things that have changed. Once we've been fully vaccinated, we can gather with other fully vaccinated individuals indoors without a mask, according to the CDC. We can also gather indoors with unvaccinated individuals from one household. So for instance, if my household is vaccinated and I'm visiting one other household that's not vaccinated, I could potentially go and visit them unmasked, as long as no one in their family is at increased risk for COVID. That's one way that our life can really begin to change. And we've seen through numerous polls and surveys that the #1 driving factor right now is individuals want to be able to spend time with their families. Individuals want to get back to some kind of life that includes spending time with family and community. And this is absolutely one of the great benefits of being fully vaccinated.
It's great news, and it's really a relief to see that progress is being made with the vaccine.
We also have tremendous resources from our Massachusetts Department of Public Health. They have a fantastic campaign called Trust the Facts, Get the Vax. And again, really important messaging that's coming out from trusted leaders in the field, videos, tools, and so on, that the public can go to, take time with your family, watch these things, and make sure that you feel like you have the information that you need. The hyperlink there would bring you to the full campaign, resources, videos, and tools that can help you understand how Massachusetts is endorsing and supporting and advocating for all of its residents to get vaccinated.
In Massachusetts, we've been going through these phases, basically at the direction of the Department of Public Health, to determine who is eligible to get the vaccine at any point in time. So we've been through phase 1, which was for healthcare workers. We're now into phase 2. So anyone above the age of 65 qualifies today to get the vaccine and should be getting it. Also, if you have 2 or more medical conditions, and I'll show you those conditions in just a minute, then you qualify and should get it. In a week or 2, also essential workers will be eligible. So these are K through 12 teachers, utility workers, delivery people, grocery store workers. And then soon after that, if you have 1 eligible medical condition, you will be eligible and should get the vaccine. And then into next month, the plan is that basically we'll be vaccinating the general public, which is, as Dr. Huebner-Torres said, extremely exciting.
Just want to point out one more thing. Don't forget the low-income housing. Those folks can get in now as well.
Good point, Shamika. Thank you. So these are the conditions, and I'm going to read them off here. So if you have 2 of these are the things that should trigger you to get a vaccine today. So cancer, chronic kidney disease, COPD, also known as chronic obstructive pulmonary disease, Down syndrome, heart conditions, a weakened immune system, obesity, pregnancy, sickle cell disease, smoking, diabetes, and asthma. So those are the eligible conditions that are current in phase 2.
All right, so how do you sign up for a vaccine at the CDC? Just want to point out, did you guys not hear what Christina said, that if we get vaccinated, you can hang out with people? I mean, we have all been so isolated and like deprived of our families and our friends and that contact. I'm excited. I myself am fully vaccinated, and I'm so excited. So you want to hang out, you want to be with your friends, how do you do that? So you can get vaccinated here at Caring Health Center. For the patients, you can look out for a well text. That's our app that lets you know about your upcoming appointments. You can also text questions you have. So, and for the community, we are, like I said, proud to announce that we will be opening up our own vaccine clinic for the community. And beginning Thursday, not today, Thursday, tomorrow, you can call 413-693-1015, and we'll be happy to schedule you for that appointment.
So we look forward to providing you with clear answers. We want to answer your questions. We want to hear what your concerns are. And we want to make sure that you feel confident that you have the information you need to make a decision. And we do encourage you to get a vaccine.
Thank you so much. That was a lot of helpful information in that slideshow. That slideshow will be available for the public. We'll make sure that we'll get that out through email or social media and through the community. So myself learned a lot from that presentation. So I want to thank all our presenters and the staff at Caring Health Center that compiled that important information. Fantastic job. Now I want to hand it over to my co-moderator, Rep. Gonzalez, and we're gonna get into a little bit of questions for our panelists and just reiterate some of the stuff that we learned. I know for the interest of time, we want to keep this tight in an hour, and we're just gonna go right into it. Rep. Gonzalez.
Thank you, Senator, and thank you again for the great information, because again, it addresses many of the myths and the questions that are out there in the community. Specifically with your agency, you have so many languages that you are able to communicate the appropriate information to make sure individuals can, again, we're not telling people they have to get vaccinated. You're asking them and making available for those who want to get vaccinated. I think that's critical and important. But the first question is, because I've heard it over and over, is if I go get the vaccine, they're gonna give me COVID in order to be able to be immune from COVID. Is that true or not? Can the vaccine give me or my family COVID-19?
Thank you, Representative Gonzalez. The answer to that is no. None of the COVID-19 vaccines being used in the United States have live viruses, so they can't give you the disease. And because you don't have the live virus, you cannot spread it to anyone in your family or within your networks. Thank you.
And another critical question that I hear in the community and talking to some constituents, and obviously information is disseminated to the public in different ways. There's also this question is, does the vaccine have something in it to track or control people? And I know we heard that a little bit about it. Let's, if somebody can answer that again.
Well, I'll be happy to answer that one. So the COVID-19 vaccine, it doesn't stay in your body. So there's nothing in it that's left or can track that can be tracked or controlled. So once you get the vaccine, it's like training your body's immune system to recognize this virus and be able to kill it. So in that training process, it's using all of the material up so that it's fully destroyed. So this is our way to keep us safe. However, with that vaccine, there is a monitoring that we have to do. So we do have to keep track of everyone who is vaccinated, and that's the only way that we are going to be able to know if we have enough people vaccinated to get our herd immunity, so we can continue to some different level of normalcy and be able to associate with our friends. So with that being said, in that database, it is confidential, and the only ones who have access to that database would be your healthcare providers and public health officials. That is the only tracking of that we do, nothing else.
Moving forward with questions, I don't know if any individuals in the audience have questions, but I do want to go to the point of actually getting the appointments. I think the city of Springfield will be outlining soon. The vaccines are coming, and the city of Springfield is going to have some locations that they're going to be unveiling, as well as I know the hospitals, Bay State and Mercy, are doing for their patients vaccines, and I'm so excited that with the bilingual outreach team that we have established with working with the Caring Health Center. Some of our residents that have difficulties getting the appointments through the use of technology or transportation challenges, linguistic challenges, and you guys have been out there in the forefront doing that. I just got the phone number for folks to call for their appointments, which you are going to be allowing individuals from communities of Springfield, or is it from the general Western Mass population? And I see the number, but is there a website, or are you just going to allow them to call in and set the appointments?
Well, right now we only have the phone number. We are working on getting a technical app type portal so that folks will be able to go on there as well. But right now it's just the phone number, which they can call starting tomorrow. And it will be any community members. As long as you fit in the phase and you will live a resident of Massachusetts and we can get you in, we'll be happy to get you in.
That is fantastic. By all means, Madam President.
Thank you. I'm just going to jump in. I'm really excited about this opportunity because one of the things that Caring Health Center has been working on is to expand our reach. And so as Shamika stated, we're still in the beginning stages of getting the site set up, getting the information, contact information set up, but that information will certainly be forthcoming within a matter of days or at least by a week or so. But we're really excited about being able to expand our reach to the community beyond our patient capacity.
That is truly an amazing feat and an amazing information. I really commend you and your team for me with no knowledge, really being able to announce that information here on this Zoom and to the public. My hands come together in praise and with love and admiration because it's hard work to make sure that we are making sure that the information and the misinformation is being dispelled, to make sure that we are serving everyone in the community, and that's what Caring Health Centers has been able to accomplish through the years. So I know we are at the end of our time. I know that's we probably couldn't get to all the questions, but we're going to hear from some closing remarks from Rep. Carlos Gonzalez, and also again from Madam President Tanya Barber. And with that being said, my name is Adam Gomez, a state senator for the Hamden District. I represent 2/3 of Springfield, West Springfield, the whole entire district of West Springfield, and also 3 districts in Chicopee. I am humbled to serve. I just want to put my information out there that you can reach out to my office with any questions at adam.gomez@masenate.gov, or also you can reach out and link up with me through social media at Adam Gomez MA, and my staff and myself, also with Caring Health Center and partnering with all our healthcare providers, are ready to serve the residents and the community of Springfield. I just want to thank you for the opportunity to be able to build and moderate this important discussion. And if there's any more questions that maybe we couldn't get to, please email me or contact Caring Health Center, and we're ready to work for you. So Rep. Gonzalez, closing statements, closing remarks, and then we will end with our fearless leader from Caring Health Center, Madam President Tanya Barber. You are on mute, good sir. I apologize. Just wanted to reiterate that.
Thank you, Senator Gomez. Muchas gracias. And to the Caring Health Center team, once again, I just want to salute and congratulate you for the hard work and effort that you do. The pandemic has highlighted the health disparities in communities of color for too long have existed, particularly including those essential workers that through your presentation you highlighted. Essential workers that are low-income earners and can't afford health insurance, and companies are not providing health insurance for them. So there we have seen a major need, and it's basically comes down to the high incidence of poverty. And we have to address poverty, and we're going to be intentional from legislatively to address poverty from all aspects, because I think it's a lead indicator of the health disparities that we see today, and also highlighted through the COVID crisis, but historically in communities of color. Again, we're going to continue to advocate for local and community-based testing and vaccinations, but I don't want to lose sight of testing, because I think for some folks that will not take the vaccine, testing is going to be a way for them to stay healthy, and assuring other members of our community to stay healthy. We're going to continue to assist our seniors in setting up those appointments and vaccinations, hosting community information centers, sessions like this to continue to get the word out about the opportunity to have vaccines available, and helping setting up appointments. Thank you for having all the linguistic information out there in so many different language. And again, we will continue to work with our legislators and colleagues and our governor, our mayors, and our health department here in the city of Springfield to make sure that vaccines are accessible to all communities that would like to receive that vaccine. Again, thank you to the doctors, and thank you for your team, Tanya, and we look forward to working and continue working with you in the near future as you expand, not only on Main Street, but I hope in Sumner Avenue that you will soon have that site also available. And we will gonna continue to help you champion that effort.
Thank you. Again, thank you both to Senator Adam Gomez and to State Representative Carlos Gonzalez. We really appreciate your ongoing support, working together, collaborating together again with this great effort. And you mentioned Main Street, being able to have that facility available for folks to get vaccinated. And you mentioned Sumner Avenue. We are excited to say that the vaccine site will be located at Sumner Avenue. So again, that information will be forthcoming. I don't want to share it prematurely. I want to make sure that everything is set up and ready to go, but we will have that information shortly. Again, I want to really thank my team. My team is outstanding. They really do an amazing job. You can imagine, we've been really inundated from day one. We're on the front lines, along with everyone else to make sure that our community is safe. So thank you to the team, to Dr. Christina Huebner-Torres, Dr. Jonathan Mosley, Shamika, and the others who work so hard to make sure that, we're providing safe care for our community. And then also the testing, again, State Representative Gonzalez, you mentioned the testing. It is very important. As Dr. Christina Huebner said, we are working with the community-based organizations in collaboration with partnership with Be Healthy, partnership with Bay State Health New England, and a number of others to make sure that we're increasing with the city of Springfield as well, to make sure that we're increasing testing. So great work to the mayor in terms of expanding the mass vaccine sites. And again, we're just a branch of that. We're an extension of that.
I'm trying to figure this out. I don't want to record this.
Meaning that we're trying.
I'm trying now.
Isn't it your friend who's going to answer the phone?
Extend the services out to the community. So again, I really just want to, don't want to belabor everything, but I think I'm going to end it right here because of time. But again, thank you to everyone. And as Dr. Christina Huebner-Torres also said, it's your choice. The team is encouraging that folks get the vaccine, but again, it is your choice, and Caring Health Center is available, and our doors are open to you regardless of whether or not you have the ability to pay for healthcare or of course to get tested or vaccine. Our doors are open to you. So again, thank you to each of you.
And with that being said, I want to thank all of you for your hard work, and also a big shout out to all the women on the call, because this is Women's History Month. We appreciate you, women leaders. I see so many of you that work hard and diligently for our community. So my hat's off to you, and God bless. Talk soon. Let's keep on pushing. Let's get through this together. Thank you so much.
Gracias, adios.
Thank you.
Thanks, everyone.
Bye-bye.
Bye-bye.